First, let's talk about the two adult chains of survival. One is for out-of-hospital cardiac arrest, and one is for in-hospital cardiac arrest. Both chains have 6 links, but the links differ slightly. Both chains include activation of the emergency response system, high-quality CPR, early defibrillation, post-cardiac arrest care, which may be provided in the cath lab or the intensive care unit, and recovery.
For the in-hospital chain, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest with patient monitoring and assessment and, if necessary, rapid response by the medical emergency team when a patient's condition starts to deteriorate. For the out-of-hospital chain, the difference is the fourth link, which focuses on advanced resuscitation. In this link, a multi-rescuer team arrives and takes over CPR and may perform additional advanced interventions.
Because most adult cardiac arrests occur at home or in other places that are outside of a hospital, we'll look at the chain of survival for an out-of-hospital cardiac arrest first. A son drives his father to a doctor's appointment. The father collapses, and his son realizes that he needs to find help. A nurse runs out of the doctor's office and tries to get a response from the father. She recognizes possible cardiac arrest and sends the son into the office to call for help and set the emergency response system in motion.
The chain of survival begins right here, with the nurse's immediate recognition of possible cardiac arrest and activation of the emergency response system. A rescuer must first recognize the signs of cardiac arrest, such as unresponsiveness and lack of normal breathing. After recognition, the rescuer should immediately activate the emergency response system and begin high-quality CPR.
Effective bystander CPR provided immediately after cardiac arrest can double or even triple someone's chance of survival. Bystanders who aren't trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult collapse suddenly, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers or telecommunicators may provide further instructions, including step-by-step coaching on how to perform CPR until trained help arrives. Some healthcare providers might find it necessary to provide compression-only CPR until a barrier device is available.
The nurse begins chest compressions without delay. The office assistant summons another nurse to help. The second nurse arrives with the AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight, portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal.
Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the person loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing lay rescuers and healthcare providers to attempt defibrillation safely.
Once EMS providers arrive and take over, they provide advanced life support. This extends the chain to give the person the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment to the person.
After the person achieves return of spontaneous circulation, or ROSC, EMS transports the person for post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and improving long-term survival. Recovery from cardiac arrest continues long after hospital discharge and includes physical, emotional, and family support. These 6 links show the most important actions needed to treat cardiac arrest.
BLS is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for people of all ages and practice delivery of these skills, both as a single rescuer and as a member of a multi-rescuer team. Now let's go back and review a rescue, focusing on the steps of BLS as they happen.